Well, let's bring on our next guest, Mark Poling, who's co-founder and CEO of Colibrium. And Colibrium is really doing a unique software-to-service platform that really is bringing health insurers and members together, enabling them to communicate much better together and focus on engagement. And Mark, welcome to the program.
Good morning, guys. Thanks for having me. Good to talk to you again.
Yeah, nice to have you on the program. Are you out in Washington today, or?
Yes, I am out in Seattle. Just got back last night.
Yeah, you're not in the cold, frozen chosen like our last guest was in Chicago. Mark, we'll see you and your team soon at Private Exchange Forum in Dallas, and we look forward to that. Tell our market more about what you're doing at Colibrium, please.
Really, what we're trying to do is enable the health insurance plans to really engage with their members, both from an acquisition and selling perspective, but also servicing and retaining those members. A lot of health insurance plans, they only engage with about 5 to 10% of their members, and it's pretty hard to be a consumer-centric organization when that's the full population that you're engaging with. So we're helping health insurers do a better job of that.
And where do health insurers start to better understand consumers?
They need to start with the obvious, what their members are buying, what benefits they're using, what they're not using that they should be, and what they need that they don't have. So you've got somebody out there that doesn't have dental coverage, trying to get in front of them with that. You've got somebody whose children are turning 27 and aging off their policy, getting in front of that and proactively connecting with that person to help them through the process. Because, as you were saying, it's more complex now than it ever has been. You've got subsidies, you've got different, more accountability on that member. So helping them through that process.
Yep. So, for the most part, do you see health insurers not already doing this? Or are they now opening their eyes to what they need to be doing?
We see a lot of eye-opening, for sure. Historically, they've relied on the broker channel to build that relationship with the member, and they've been very siloed in terms of I've got my Medicare market, I've got my small group market. And because of that, they don't today, most of them don't have a full view into that member's life journey. They have the data. They don't have a way to bring it all together into a cohesive view and really leverage that in terms of how to engage with that member.
Mm-hmm. Ron, do you have a question for Mark?
Oh, I do. I mean, this is an exciting area, Mark. I worked for an insurance company for many years, and I think you're exactly right. They have an awful lot of data and information profiling an individual, but rarely do they do any kind of real data mining in that space. Tell us a little bit about what kind of data in the insurance arena are you delving into? Is it just the claims data? Is it other enrollment data, financial data, other insurance coverages that may be outside of healthcare? What kind of things are you doing for an insurance company to help them profile their clients in this way?
If you think about it like Amazon, is really what we're trying to do. When you go to Amazon.com or you call Amazon, they know who you are. If you call, they know by your phone number. If you go to their website, they know what you've purchased and they know what you've looked at, so they can engage with you. So we're trying to help the health insurance plan do the same thing. So when somebody comes to their member portal, and their group has dropped coverage at renewal, the health plan knows that, and rather than sending you a dental brochure for their dental plan and trying to upsell you, they're reaching out to you with, do you understand, the options available to you? Do you understand, the federal exchange process, that you might be eligible for a subsidy, and those types of things?
Are you bringing in, or are you planning in the future maybe to bring in other data? You're kind of working in what some might call these days, big data. Are you bringing in other information that might help profile or show other life activities that a person is doing, so that the insurance company might know if they're positioned for mortgage insurance or a disability policy or vision care? other aspects of their life? Are you able to bring that in, or is everything centered on the insurers' databases?
Primarily the insurers database is where we're focused today, but we really have two major modules of software. One is what we call our marketplace, and that's really intended to be your online interactive engine with the consumer, and the other is what we call our 20360, which is a CRM overlay for Salesforce and Dynamics, and those two are connected together. So the concept is we can pull in claims data into CRM. We've got every time you've called customer service, and we also know which products you've purchased and what you might need based on your demographic profile, how you're using your benefits, how you're not using your benefits, what age your children are, and that type of thing.
Hey, Mark, this is Doug again. When did you roll these solutions out to the market?
It's interesting. We launched product in 2009, and a lot's changed since then. When we were talking about sales and service automation in 2009, the name of the game was decreasing your underwriting backlog. Well, today that's completely gone. So our focus has very much shifted in terms of, how do you manage your members and engage with them so that you can retain them, because the switching costs now, every fall are zero. So you've got the health insurance plans that have, provided intuitive tools, provided a higher level of service, they're going to win the retention game, and that's what we're trying to help them do.
So Mark, who are your clients? Are they insurers? I would say, who are your clients, Mark? Are they insurers, TPAs, exchanges, large employers? Who are you trying to target?
We're 100% focused on the health insurance market. When healthcare reform passed, we saw a lot of activity in the market in terms of, people switching direction, going after the large employers or going after the public exchanges. We saw it as an opportunity to help health plans really navigate this and become a more consumer-centric organization and really change the face of who they are to engage with those members.
Yeah, I think, Mark, I would assume, although health insurers are your direct clients, that if I'm a major employer listening to this radio segment, I really want to talk to my health insurer about what you guys are doing, because I think their hair would be on fire understanding what you're doing and the value proposition to their employees and their families.
Exactly, and that's part of our value proposition to the health insurers is, if you've got better tools for your employers and employees, which we provide, you're going to attract those employers, because the game is much more complex and difficult for them today too.
How do you see, when you look out across the marketplace, how do you see 2016 evolving as far as the movement of the market towards your solution set?
So we see an enormous amount of interest in our CRM platform because most health insurance plans really haven't maximized their CRM capabilities. We also see a lot of attention on intuitive decision support tools for members, for employees, for employers, and for brokers. So we believe there will be more and more focus and emphasis on those intuitive tools to really help all the constituents through this process, whether it's at renewal or administrating the process as they go through the year, or acquiring new groups and members.
Ron?
Yeah, Mark, give us a little bit more detail about how your systems not only help the insurer to profile, but maybe some examples. How does one of their plan policyholders benefit from the work that you're doing directly with the insurer? Is it helping them understand what might be happening in terms of their medical care, where they should go, additional information, sort of what you might call push technology? You're sending them stuff that they should need, maybe in advance of getting a test or a treatment that may be upcoming, or maybe some of the early conditions from their data shows that they may be having some heart problems. How does it help the the member out there exactly?
It helps the member by automating targeted information going to them via the channel that they prefer. So we're helping the health plans collect and understand what medium people want to be communicated with. Is it mail? Is it a phone call? Is it a text? And then using that CRM engine as an automated distribution platform to distribute that type of information based on what's going on specifically with that member. So if they're enrolling for a plan and we connect the health risk assessment at the point of enrollment, taking that information and then automatically getting the information to the member that's beneficial to them. So, rather than sending a fitness wellness program to somebody that just said on the health risk assessment that they ruptured their Achilles tendon 2 weeks ago, sending them rehabilitation information on how they can get better sooner, rather than join our walking and jogging program and earn rewards.
So how important is the health risk assessment data that they send in, and maybe assuming you're getting also the prescription drug history and medication that they're under? Is that true?
Yeah, that's exactly true, and it's critical. And adoption, has been elusive for health plans in terms of the HRAs. Just getting more people to complete those so that they understand more about that member and can be more proactive. So our tools are designed to really engage that member, keep the process simple and not make it feel like a lengthy, form that you've got to fill out, that you have in your to-do mail pile forever, but engage them online, engage them on a mobile device to get that done.
So what is your business model? Is it all charging the insurance carrier for those services, or is there some fee or cost ultimately going back to the individual?
No, it's our revenue model is with the health insurance plan. So it's there's a lot of ROI for them if they can do the things that we've been talking about better. It enables them to do more revenue diversification because they've established that relationship, and revenue diversification in terms of ancillary products, et cetera, is critical, but you can't sell somebody something like that effectively if you don't really know who they are.
Okay, one more question, and then Doug, maybe you can jump in with what you've got there. What's your competition here? Because I know having worked in the insurance industry, a lot of times they think they can do everything better internally. So tell us about how your growth is and what your expectations are as an outside service selling to the insurance industry. Is that something that I know it's a hole that they need, so I'm really great. It's a great idea that you're in there, but what's your competition, and how difficult is it to be working with insurance carriers that sort of think they can do everything internally?
We do. Health insurance IT historically has always been our largest competitors, but I think more and more they're recognizing the value of our platform is the integrated marketplace with CRM. We've got a lot of competitors on the marketplace side, and there are some great innovative firms out there doing some very fantastic things. We think we match up very well with them, but there aren't very many that have the CRM component essentially embedded in that marketplace. And when we talk to health insurance IT organizations about CRM, CRM is a very dirty word in a lot of health plan organizations because there's been so many failed initiatives. So when we talk about our overlay for Salesforce and Dynamics in accelerating that implementation process by 6 to 12 months because it's already pre-configured for a health insurance plan, it's a pretty powerful statement.
Mark, listen, I've really appreciated having you on this segment and you taking the time. I'd like to give you the opportunity to leave our audience with some closing thoughts, if you would, please.
Yeah, certainly, and thank you guys. Please contact us if you'd like to learn more. We're really trying to help health plans, begin to establish that relationship at the very first point of interaction, helping people through that complex buying process with decision support tools so that they can win in the acquisition game, service their members better so that they build a relationship, and then they'll win the retention game.
Mark, thank you so much for joining us. And I want to remind our audience that may be listening that's going to be with us at Private Exchange Forum coming up in Dallas that the Colibrium team will be with us in Dallas, and look forward to seeing them down there. Mark, have an enjoyable weekend out in Washington. We'll see you real soon.
All right. Sounds great. Thanks, guys.
Take care, Mark.